One of our students reported that when she passed a worm, a 2-foot worm, she had immediate improvements in her cognitive function, in her energy, and in her mobility. She actually had improved mobility that she hadn't had in years. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. This type of story is something that I hear weekly from our students that are recovering from multiple sclerosis and other chronic diseases that we know are infectious diseases, and they're caused by parasites, by a parasitic infestation. And it's really shocking that when we pass these worms, we can notice immediate symptom improvements. What I'm going to share with you is the types of worms that these students are passing. Today we're talking about roundworms. We're going to talk about what they're using to treat. I'm not going to share the worm pictures here, but later, if you would like to actually look at what they're passing, then make sure that you will comment the word roundworms, and then we'll send you the link. My team will probably tomorrow morning, they'll send you the link for the research. So today we're going to talk about the research. We're going to talk about the experiences of our students. And the first talk that I did was talking about fungus and how there's decades and decades of research linking candida, but also mold, to multiple sclerosis, but other chronic diseases, and how significant they are in causing symptoms. Then we talked about, I believe it was Borrelia. So this is the spirochete that causes Lyme disease. And I shared research dating back to 1911. Really profound research. And it's so big that the MS Society really struggles to tell the difference between MS and Lyme disease. We talked about Babesia, which is a parasite that infects our red blood cells. That's really common with multiple sclerosis. And the exciting new research that's coming out showing that MS is a vascular disorder, and talking about how the lesions are located around blood vessels. So this is a gold mine of research that I'm sharing with you. Then I shared with you the filarial worms that were discovered by Dr. MacDonald, and that has been blowing up on social media, and I'm really excited. Thank you for helping us get the word out. The more we talk about this, the more we share this. I actually talked with a physician's assistant today, and he's just really intrigued by the work we're doing, the research we're doing, and it's really exciting to hear that. So today we're going to talk about roundworms, like big roundworms that are found in the digestive tract of MS, and their larvae do make their way into the central nervous system also of multiple sclerosis, also other diseases too. You might be thinking to yourself, Pam, you're talking about all these parasites in MS, like how is that even possible? It's kind of hard to believe. Well, if you have ever gardened before, you know that when you are trying to keep up with the weeds, you never ever have a single type of weed. You have multiple different types of weeds growing in your soil, in the garden. And so that is the same thing in our microbiome inside our body. We have multiple different types of microbes that get out of balance. And it's really what we were exposed to in the environment. So that is the problem, and we call that, there's a scientific name for that, it's called dysbiosis, and that just means we're really out of balance. So for people that have MS, ALS, Parkinson's disease, Alzheimer's, they are really out of balance, right? They have a parasitic infestation. They have worms, they have protozoa, fungi, and bacteria. Those are the major categories of the different types of parasites that cause disease in humans. And so we're looking at some of the biggest culprits in multiple sclerosis, but these would also be present in other diseases. And with MS, what we have seen in our students, and this is supporting thousands of people over the past 10 years, is that it's not always the same types of parasites that are causing the MS symptoms. It's like really where the parasites are located. So if a certain type of parasite is located inflaming a certain nerve or in a certain region of certain nerves, then you're going to get specific symptoms. But different parasites could be inflaming that nerve. And that is the frustrating thing. And that is probably a really big reason why we don't have a cure for multiple sclerosis yet, because we're looking for a single cure a single culprit. And the other reason why we're not finding a cure is that we are focused on looking at MS as being an immune problem. Like our immune system has gone haywire, it's attacking our tissue for no reason. And so if we're stuck in that paradigm of thinking, we're never, ever going to get to the root cause. That is why it's so important that you guys share all the research I share with you. Go onto our blog post, like you're going to get, if you comment the word roundworm, we will send you the link. And that way you can look at it. You can scan my notes. You'll be able to look at the condensed video or share it with other people, share it with practitioners. That's what our students are doing. And that's why I got the phone call today from that physician's assistant, which is really exciting. And he was a little skeptical at first. I totally understand because I'm not a practitioner. I'm not a doctor, and I'm not even pretending to be one. I'm an educator. I'm a coach. Understanding roundworms, we're talking about large roundworms. If you were to look at them, they look like a spaghetti noodle. Like they're not flat, they're round, and they're long, and they're skinny. They are one of the most abundant animals in the world. They're considered animals. They're part of the animal kingdom. They can be microscopic. So we talked about the very small roundworms in the central nervous system that Dr. MacDonald found. We did that last week. Today we're going to talk about roundworms they could be 4 inches long, 6 inches long. They could be smaller, right? But the ones that we're talking about today, like our students have passed worms that are anywhere between 1 to 2.5 feet long. They infect our intestines. They can infect our respiratory tract, our circulation system, our blood vessels, and they get into the central nervous system. And again, in the central nervous system, it's more the larvae that are the problem. There are specific roundworms that infect only plants, and there are specific roundworms that do infect only animals. But the ones that do infect, let's say your dog, they can infect us also. They're not just only living in our dogs, in canine. So let's talk about the different types of roundworms, which are relevant to multiple sclerosis and other diseases. It's just that we have a much higher level of these parasites. So you may have heard of Ascaris worms. So that would be like the human roundworm. And they live in the small intestine. So we have a small intestine, which is about 20 feet long. That connects to the large intestine, which is about 5 feet. It looks like an upside down U, the large intestine. So these roundworms, they mostly live upstream in the small intestine. So when we're doing enemas, we can't reach them. That's why we do have to use different types of therapies orally to treat them. They can lay 200,000 eggs in a day. In the literature I looked at, they're like a person can have at least 100 worms in them at a time. But our students have reported passing hundreds of worms. So everything that I'm sharing with you, when you look at the research, it's so understudied that it is not very accurate. The Ascaris roundworms are known to infect humans. And then we have the Toxocara roundworm, which is found in our pets, in our dogs and our cats. Again, it's another nematode, which is a type of roundworm. These are all roundworms. And the assumption is that the larvae, they don't mature in humans, just in animals. But that has never been proven, and I don't believe that's true. Like, unless something has been proven, it is not true. It's just not studied. So this really is a dangerous assumption. It really ignores insufficient parasite testing. And it is known, the larvae of the roundworm, they are known to cross the blood-brain barrier. There's also a roundworm that infects raccoons. And this roundworm, so like you may have raccoons, you may not. You don't have to get them from raccoons, but that's one source. And it's been documented that the roundworm, the large roundworm that infects raccoons, it causes the same type of, it's called neural larva migrans, which I talked about last week. And that's where Dr. MacDonald found that the larvae of these filarial worms, the very small worms, neural means that they're getting into the central nervous system. Larva means it's the immature form, and migrans means they're moving around. So the raccoon roundworm larvae, they do the same thing. They can get into the central nervous system. This is documented, and they can cause damage. This they move around and they migrate. And you might be thinking, well, Pam, I'm not going to get a roundworm from a raccoon. I don't know if you saw recently, you can Google search this, but there was a woman, and I believe she was possibly in Australia, in a country where they found a worm in her brain, and that worm was from a snake that inhabits the environment around them. So, and I think she would go out and forage some natural plants or vegetation. So all it takes is, like having raccoons drop their waste in our garden or on some of the leaves of our plants. Like, parasites are pretty hardy. So that has been well documented, that the large roundworm that infects raccoons, that it invades the central nervous system and it causes demyelination. So I've lightly talked about this before, but this is bringing evidence that the larvae of roundworms in the central nervous system cause demyelination. Somehow we ingest eggs, and if a worm is dropping like 200,000 eggs at a time, that's a lot of eggs. So the eggs, we ingest them and they hatch in the intestine, then they migrate to the small intestine, and then they enter the bloodstream. So very often they don't just live in the gut. And that's the problem, is that why it is so important to treat parasites regularly is that you want to kill off the adults or the larvae in the digestive tract before you get such a heavy burden of parasites and the larvae start to break through the intestinal wall, move into the blood, move into various tissues, move into the central nervous system. And this happens with roundworms and tapeworms. And I've heard flukes also. I'll go deeper into that topic within the next couple of live events that I'm talking about. So the larvae, some of the species, they migrate to the liver or to the lungs. If they're in the lungs, sometimes like our horses will cough. I'll notice, I bought a horse last year and she coughed a few times and I'm like, oh, that's great. And so I dewormed her and she passed these really big Ascaris worms and she didn't cough anymore. So there is also, I've talked many times about the gut-brain axis, about what happens to the nerves in the gut. So if you have inflammation in the digestive tract, it can cause a lot of neurological symptoms because there is this highway of nerves between your intestines and your brain. So it's not always the lesions that are causing all of our MS symptoms. It can also be inflammation in the digestive tract in our intestines caused by these worms that is causing a lot of different types of symptoms. People that are diagnosed with MS, they have tested and studied this, and they found that they usually have gut issues, gas, constipation, different types of pain years before they were diagnosed with multiple sclerosis, years before. This is really consistent to the point where they acknowledge this in science. So a large cohort study, they looked at GI symptoms and they found they were significantly increased 5+ years before MS diagnosis. That's very consistent with what we understand. So people with MS, they have higher incidence of inflammatory bowel disease, irritable bowel syndrome, constipation, gastritis, and that's all significantly higher in multiple sclerosis. Actually, that reminds me of a new student, and I don't believe she even has MS. Trying to remember if she does or not, but because she's quite new, but she literally, I don't think she does. She joined our program and she was literally feeling like she was dying. She had so much pain in her stomach and it's heartbreaking. It's heart-wrenching. She's been to emergency 3 times. The doctor's like, you're fine. There's nothing wrong with you. And she's like, Pam, I feel like I'm dying. I just want to die. It's just terrible. And she has started the diet and she has started just doing the oxidizing enemas and she's passing multiple worms a day. And she's to the point, and this has just been a week and a half or 2 weeks maximum. And she's to the point now where she's communicating with me calmly. And can you imagine going through that living hell when it's such a simple thing to treat, but it's completely missed in our healthcare system? So finding that multiple sclerosis in studies that when 5 years before we were diagnosed with MS, up to 5 years, we're seeing all of this huge increase in all this gut issues. That really tells us that MS doesn't start in the brain, it starts in the gut. And intestinal parasites, roundworms, flatworms, flukes, they disrupt the gut barrier. There's a blood-brain barrier, and there's a gut barrier that prevents things from moving from the gut into the blood to the rest of the body. So chronic GI inflammation precedes neurological symptoms. So they've had gut issues for years before they started getting the MS neurological symptoms. And this really supports the infectious disease model of MS, where parasites colonize the gut, the digestive tract, the intestines first, and then they migrate to different parts of the body. If we have multiple sclerosis and digestive issues and parasites are involved, then treating gut infections can, number one, before we're diagnosed with MS, it could help prevent multiple sclerosis. But if we have MS and we treat parasites, then we can recover from MS. And if you've just joined us a little bit late, just know that I'm not saying that large roundworms are the only parasites that cause MS. I'm giving you so much research, and thank you so much for sharing it, because it's really blowing up in social media. It's about time. It can only happen with your effort. It can only happen with the people sharing this. So this really strengthens the case that MS is a consequence of a parasitic infection, not autoimmune disease. Our immune system has not gone haywire. It is going after what it is supposed to do. It is going after parasites. That's its job. That's why we're dealing with inflammation. Let's look at the childhood dog ownership link to multiple sclerosis. So the research shows that there are multiple case-controlled studies that show dog ownership in childhood significantly increases the risk of multiple sclerosis later on in life. Exposure during adolescence, particularly associated with MS risk. That was me. Like, I lived on a farm. I had dogs. I had cats. I had all kinds of animals. And I was on a lot of antibiotics. That's one thing we haven't talked about here. If you had a dog in your adolescence, then they have linked that in research to be associated with an elevated MS risk. And then there are meta-analysis, so that's where they're looking at multiple studies and they're kind of analyzing common themes in the studies. And that meta-analysis confirms association between childhood pet exposure and MS development. The next study or the next research I'd like to talk about is the Toxocara connection. So dogs that become infected with this Toxocara roundworm, large roundworm, children with dogs have higher exposure to this roundworm, the Toxocara eggs, in the environment. So the dogs usually are putting their feces on our grass, and also if we have pets, very often we have them in the house. So the dogs step on their poop by accident, and then they walk in the house, and then they bring the eggs onto the floor, and then little kids are crawling on the floor, and then they put their hands in their mouth. It's that easy. So the soil can be contaminated, and contaminated surfaces like our floor. Also, if we don't wash our hands well enough. So the Toxocara larvae, as I mentioned before, they cross the blood-brain barrier and they persist in the central nervous system for years. Again, if we have a small amount of parasites, whether it's in our gut, whether it's in our blood, whether it's in our central nervous system, we might just have like minor little symptoms. Like somebody might get, like occasional muscle spasms, but they don't have an MS diagnosis. But it's not until years later that they get more persistent muscle spasms and they end up with spasticity and they get other neurological symptoms. And it really has to do with the degree of parasitic infestation and the different types that we have. So early life infection results in chronic central nervous system inflammation, and this can develop into multiple sclerosis years later. So for myself, I can just speak for myself. I grew up on a farm, and I was outside all the time. We had lots of different animals, and we also did horticulture. So I was in the garden. We did transplanting plants and digging. And of course, the animals would do their business in the ground too. So I was always outside. At that time, the doctors really believed that antibiotic use was really important. And so every time we had a high fever, without a culture, they would just say, you need to be on antibiotics. They told my mom that back in that day that if her children got chronic strep, that it could damage their heart. So my mom was really worried that, when we'd get sick, she didn't want us to get chronic strep. So she was like, sure, if you need to prescribe, and they didn't know the damage that the antibiotics did. So we were on antibiotics regularly as children, which really decreases or disrupts or destroys your natural defense, the good, healthy microbes that would defend you from the parasites that you're being exposed to in the environment. So the combination of all the antibiotic use and having the exposure to parasites. And then when I was about 12 years old, I had stomach aches all the time. I had constipation, and the doctor felt that it was my appendix. So he removed my appendix, and he said, oh, your appendix was totally healthy, which is really sad. And I have a huge, back in the day, it's not like a little incision, it's a large incision that you get from that. So it was really significant for me. It wasn't like a little bit of stomach pain. I would have a bowel movement maybe once a week as a teenager. And I just thought that was normal. When our family would have like Chinese food, which wasn't very often, but hamburgers or different things like that, I would be laying on the floor with a stomach ache. I was always the one that had the stomach ache. I was underweight. I was a little bit slimmer than the rest of my mom tried to fatten me up by giving me ice cream, and she gave all the siblings ice cream too. And I was the one that stayed skinny, and they gained weight. So for me, like when you start to learn this, you start to go, aha, like you used to like, oh my gosh, that was me. And that happened to me. And you see all these little signs that like, Pam, like you had parasites like when you were really, really young, at a very young age. And then by the age of 28, that's when I was diagnosed with multiple sclerosis. So whether, parasitic worms cause EMS or parasitic worms really cause this dysbiosis and immune suppression, and maybe it was this Babesia malaria type that kind of pushed me over the edge, I don't know. But I'm sharing all of these different types of infections that are really intimately linked with MS so that you can start to piece together your story, and you can really start to understand why you have been dealing with this. And it's not a mystery. That's the exciting thing. And then when it's not a mystery and you know what's causing the MS, then you can start moving towards a cure. So let's look at conventional research, what it's missing. So studies acknowledge that there's an association, but they fail to identify the mechanism, and they just ignore it. Like all this research has been ignored. There is some research looking at dysbiosis, looking at bacteria or viruses, and that's as far as they go. So it's assumed that with the studies I've shared with you that there is a correlation, but they are saying no, parasites are not involved in causing MS or any chronic disease, when the scientific literature tells us that parasitic worms cause disease in animals. And we talked about that last week. For over 100 years, veterinarians have known that when those small roundworms enter the central nervous system of domestic animals, they have identical symptoms to MS. But they're like, no, we're not interested in that. We're not looking at that. It's really frustrating. So, okay, let's look at clinical evidence roundworms in MS patients. So this is the work that we do. So with Live Disease Free, we have a system, we have a plan that like at least it's getting towards 2,000 people that have taken it over the last few years. We've supported students either in self-directed, where they're just learning how to support the body. And then we've also supported them in a more intimate, accountable, helping them to build their treatment plan, working with practitioners, all of that. Because the problem is the practitioners don't understand parasites. They don't have good tests. They have not been trained in it. Many of them are not interested because they have very busy practices. In certain countries, they cannot be involved in this. Like literally in Canada, there's one practitioner, he has a PhD and he's in oncology, and he discovered the link between cancer and parasite drugs, and they're helping people with cancer but he had to leave the country because he can't do that in Canada, which is brutal. But in the US, there's a little bit more interest, so he's moving down to Florida. His name is Dr. Macus. If you know of anybody who has cancer, make sure to look into that. But they're having great success. I've known this for years, that many different parasite drugs there's research that shows that many different parasite drugs have significant anti-cancer properties. And they're using them in conjunction with chemo. Doctors are using them. They're in studies. This has been known since the 1950s. Why is it being ignored? Our students that are diagnosed with MS and other chronic diseases, they do not just pass 1 or 2 or 10 worms. They pass hundreds of worms. And you say, how is that possible? How can you still be alive when you pass hundreds? One student that documented, she passed 800 worms that she documented. I see them. I have a library of thousands of images, and they are worms. So there is no intestinal lining. It's just like normal stool coming out, or it's like watery stool if you're using water enemas, the oxidizing agent, and you just see the worm. And it's either a spaghetti noodle worm, roundworm, a scarus worm, large roundworms, or it can be looks more like a flat noodle, like a fettuccine, usually a little flatter than a fettuccine noodle. I'm just giving you what they look like. Or flukes are shorter. They can be maximum 6 inches and they're wider. They'll be like at least a centimeter up to an inch wide. They're rubbery and they're translucent on one end, and they're kind of, all of them, when they're really fresh, they're kind of cream colored. If you're taking herbs like black walnut, like the staining herbs, then the worms might look darker, but normally they look like a tan color. And so our students are passing, today we're talking about the roundworms, and when they pass them, it's instantaneous improvement in cognitive function, in mood. They just feel like a weight has been relieved. They can notice that they can have significant improvements in their mobility, which is so crazy. What I want to share with you is that how, like, a possible mechanism of why this is possible. So in science, they know that all these worms, they have ways to make themselves blind to the immune system. If they weren't, the immune system would attack them and they would get rid of them and we wouldn't have them. So they want to live in us. We are the host. And so in order to prevent the immune system from going after them, they have specific ways. I think there's at least 17 different ways that's been documented in science that they cause immune dysfunction, and they hide from the immune system. But when they start to die, so when they're if you're really infested and some of them are getting older and they're on their way out, or whether you're treating them, then the immune system is all of a sudden it's awake and it sees them and it goes, oh my gosh, there's this dinosaur monster. We've got to deal with it. And so what happens is that we get symptoms, and those symptoms are because the immune system is going after the parasite. So inflammation is the immune system's response to an invader. It's just that when you've got this massive worm that's like a foot or 2 feet long, you're going to get a strong immune response. But the crazy thing is if you're doing these oxidizing enemas, like this new student, and she's passing them, it's like, wow, I don't have to go to the emergency room anymore. I'm starting to feel so much better. It's like instantaneously. Another student that just shared maybe not even a month ago is that when she did 2 of these enemas back to back and she passed these large worms, she could literally like lift her leg up. She has MS, and she could lift her leg up and she could walk pretty much normally from doing that. I've had other reports of a student doing just a few of those enemas and passing. So this isn't getting rid of all the worms. This is just getting rid of some of them that are maybe not as healthy on their way out, kind of dying, and they're in the large intestine, and you're actually getting rid of them. And people, like, he was walking for several hours a day without his cane just by doing, and he was training dogs to be like bird dogs. And so he was around a lot of animals, and just by passing a few big clumps of worms, he was able to walk without a cane over a weekend just by passing some different masses of worms. And this is what we see in our students. And it's absolutely insane because it's so common sense, and yet we're ignoring it. We deworm our dogs. We deworm our cats. Veterinarians are deworming animals all the time. They're treating sick animals, but we don't deworm ourselves. So what do you think happens over the years is that we become so infested that we end up in care homes because we're just like, we can't even move anymore. And worms cause disease. It's known in the science. We can notice more, like when we pass these worms, we can notice that, number one, our digestive tract just completely settles down. We can notice that we feel more clear-headed. We just feel happier. We don't feel depressed. We don't feel foggy head. We can have more strength. We start sleeping better. And the mobility, we can find that if we have a clenched hand, that all of a sudden it opens. Sure, we might not be able to use it very well because we haven't used it for years, but it's just insane what I have seen over the years. Dramatic energy improvements, better sleep. We talked about increased strength in arms and legs, mobility improving, brain function improving. And these patterns have been observed over hundreds and hundreds, I would say thousands of people by now that are dealing with multiple sclerosis and other chronic diseases. So we have students that took our program almost 10 years ago, and they are still MS free. So yes, it lasts. Let's look at published research about Toxocara and MS risk. So this is the roundworm that infects our dogs and our cats. So there is a study, a neurology Asia control study. They looked at antibodies against this Toxocara worm. And in MS patients, they found 14.7% of the MS patients had antibodies against this roundworm that infects our pets, whereas only 1.4% of healthy controls, people that don't have MS, they had antibodies against this roundworm. 10 times higher in MS, in the MS group. Toxocara infection increases the risk of MS. That was their conclusion, that Toxocara infection increases the risk of multiple sclerosis. There was also a 2019 epidemiological study, and there they found that when they had a positive antibodies to this Toxocara roundworm that we see in our pets, was linked with a 3 times higher lifetime risk of multiple sclerosis. Crazy. So that's another study. So this is a massive association between roundworm exposure and MS development later on. I've talked to you before about how tapeworms in the digestive tract, the larva, the immature baby form, they're living, they're not eggs, they've hatched, and they get out of the intestine, they move into the blood, they get into the brain, and they can form cysts. And Dr. Alan MacDonald, we haven't talked about that. We're going to talk about that next week. And he found that tapeworm larva was present in every MS subject he tested also. So we're seeing a huge breakdown in the blood-brain barrier when all these parasites are getting in there. But so we call that neurocysticercosis, where we have tapeworm larvae in the central nervous system of MS. Well, the larvae of these roundworms can do the same thing. They can go into the central nervous system, and they have a different name. Hopefully I can say it properly. It's neurotoxocariasis. So neurotoxocariasis. So this is when the toxoplasma larva, this is the roundworm larva from dogs and cats, when it gets into the central nervous system. So the larvae, they cross the blood-brain barrier, they're deposited in the central nervous system, they're linked with meningitis, encephalitis, myelitis, and neuropsychological disturbances. They cause inflammatory damage in the central nervous system, and they also cause direct tissue destruction, which is caused by the parasites themselves. So these would be just like larger than the worms we talked about last week. And then another case study, and this linked a specific Baylesia scaris, and demyelination. So this is a misdiagnosed infant case. So this was a child. There was a child with progressive neurological decline. And initially, they diagnosed this child with acute disseminated encephalomyelitis. That just means that acute is significant, and he had inflammation in his brain. So he was treated with high doses of steroids, corticosteroids, didn't help him at all. Eventually, it was confirmed that he had this Baylis ascaris neural larva migrans. So he had the larva of this roundworm in his central nervous system moving around. So the MRI evidence of demyelination, brain imaging showed progressive demyelination. They couldn't distinguish it between this and primary demyelinating disease. So the larva caused such significant demyelination in the central nervous system that they couldn't distinguish that between other demyelinating diseases. So what if all these demyelinating diseases we have are just caused by these larvae or other types of parasitic worm larvae or other infections like I've shared in many cases? So this really demonstrates that roundworms directly cause demyelination identical to multiple sclerosis. So the mechanism for damage in the central nervous system, well, we have mechanical injury as these worms are moving around in our brain tissue. And then a big part is going to be the immune response. The immune system has to go after them. It's there to keep us alive. So we have this huge inflammatory response. So this is not the immune system attacking our tissue for no reason. This is the immune system attacking invaders in the central nervous system. And it's well known that the central nervous system is not a sterile environment. And so we have progressive demyelination of white matter with this chronic inflammation and the tissue destruction. Let's debunk the worms are good for multiple sclerosis. So there was a couple of studies done a while ago, I think around 2020. I don't know if both of them were then, but they were trying to say that, giving people that have MS, giving them these worms would help to modulate the immune system so that it would not attack our nerve tissue. The mainstream narrative was claiming that parasitic worms were immune modulatory, and there were small trials that gave hookworms to MS patients, and popular articles started to talk about this and saying, oh, there's less inflammation. But it's really well understood that worms suppress the immune system. So in these articles that were trying to make it look like these worms were good for MS, they were saying that, we're living in this world now where we're too clean and we wash our hands too much and we're using antibiotics too much. So we're so clean, that's making our immune system just become overreactive for no reason. That's the hygiene hypothesis. It's a complete garbage theory, and that has been really promoted in the past. Maybe you've heard about it before. So what research actually shows for that 2020 hookworm study is that it was a very small study, and it was only done over 36 weeks. So it's very short, very few participants, and new MRI lesions. There were no significant difference between when you're looking for total new MRI lesions, there was no significant difference between hookworm versus the placebo versus people that didn't get it. So their findings were really inconclusive, but boy, did they run with it in the media. So their comprehensive reviews, really weak and inconsistent benefits for MS, but it's still out there, unfortunately. Parasite accumulation can provoke inflammatory responses. So people that got these hookworms, they wanted them out after a while. I read the studies and they were like, I have a lot of stomach pain, get them out. And they didn't report on that. They didn't, in the popular magazine articles, they didn't talk about that. So in time, it could actually worsen MS because we know what all these, I'm talking to you about roundworms, big and small. I'll be talking to you about flukes and tapeworms. And it's just known that they cause disease in animals. So why would they think that they're good for us? they're not immune modulatory. In the science, they are immune suppressive. They cause disease. So there's no clinical or MRI benefits that they've shown, and yet they left this horrible trail of misinformation. So the fundamental flaw in immune modulatory is that parasites, they don't modulate, they suppress. Suppression allows the parasite to live in us. Otherwise, our immune system would kill them. They wouldn't be able to live and they wouldn't be able to survive. And chronic inflammation damages tissues, including myelin. So the parasites themselves can cause damage, and this war of our immune system going after the parasites can also cause a lot of damage. And as a result, we can have myelin damage. So the more parasites we have, the bigger the war and the more damage we have. And if we're not treating that, we're not treating the root cause. In real worm scenarios, when people have hookworms, it can cause anemia, itchy skin, respiratory symptoms, coughing, wheezing, trouble breathing, abdominal pain, weight loss, diarrhea, appetite loss. How would they think this is good for MS? It just blows me away. I don't know. In children, it can retard their growth. It can impair their mental development. So the question is, why deliberately infect sick people with disease-causing parasites? I know that many of you are desperately trying to treat parasites. You're on forums, you're trying different types of parasite drugs, and I'm telling you, it's not worth it. You are not going to recover. It's just so sad. We are in this transition place where hopefully we can get this information to doctors. We can get doctors to understand this better and to be able to help us. But it really depends on what parasites you have. Ivermectin does not treat all the parasites, and fenbendazole does not either. And what's the other one? Mebendazole doesn't either. So it really depends. If you have a lot of flukes and you take roundworm medication, you're still going to have your disease. If you have a lot of tapeworms and you take roundworm medication, you might pass a few roundworms, but you'll still have your disease. Again, it's not just roundworms or tapeworms or flukes that are making you sick. It is this weedy garden, this pest-ridden garden inside of you. So there are some, for educational purposes, these are some roundworm medications. So I've talked about this before. Albendazole will work more systemically. It will cross the blood-brain barrier. There's mebendazole, which actually will just work more in the gut. But I see that they're doing higher doses with cancer. Practitioners are, clinics are, and then it may have the potential to cross the blood-brain barrier better. Ivermectin, sometimes for specific worms. Nitazoxanide also. Possibly parental palmate could be another one that treats certain roundworms. But again, focusing on one worm, you'll still have the MS. We haven't had one single person that has MS just treat roundworms and recover. But you definitely want to get them out of you. You do not want them having their babies moving into your central nervous system. The study that was done in 1983, it was a double-blind placebo-controlled study where they gave levomizole to MS subjects. And so they noticed reduced relapse rate, stabilized disease progression. This was done over 4 years. And I believe I should have pulled up the details, but they only gave them like one dose a month, I believe, or maybe it was once a week. So it was just like once a week over 4 years, significantly improved outcomes for MS. And again, that's another one it's double-blind placebo-controlled, well-done study, and it's just been ignored. So this really matters a lot because I've just shared with you a ton of research, and levomizole does treat roundworms also. I don't believe it's available in the United States. You know why? Because I read that in the illegal drug trade, they mix levomizole with an illegal drug, and it can cause terrible adverse reactions. So that's why they decided to take it off the market. If it is not harmful when used properly, and it can be life-saving when used properly, then we take it off the market because it could be used improperly in drug use cases. Like, sure, we don't want that. But if it's helpful for people and it is a safe drug, then they don't take other drugs off the market that could be used improperly when the drug, like there's lots, I'm not going to go into them, but you know which ones they are. Complementary therapies, like what we have found is that our students, because we're dealing with dysbiosis, they usually test well for 3 to 5 parasite drugs at a time. It's usually more like 5. Right? Because some of the parasite drugs will treat roundworms. We're going to talk about the flatworms over the next couple of weeks. Make sure to invite people, make sure to share it. Let's get people talking about it. Like if 1 million people talk to their practitioners and they just keep getting bombarded about parasites, the good doctors are going to start going, what is going on? I need to look into this. And I do have really good resources that you can share with practitioners, like a PDF page. If you want the link with the research and my blog post on this with all the topic, just type roundworm in the comments and we'll get that to you. So going back to treatment, it takes multiple cycles. I mentioned they can lay 200,000 eggs in a day. There's larvae, there's eggs, they're hiding under biofilms. So people are treating over multiple cycles. If you've been sick for many years, it could be 6 to 12 to 18 months of treatments. But it's like hit them, take a break, hit them, take a break, hit them, take a break. And each time you're feeling better and better. So you get to the point where you're completely symptom-free, treating the various types of worms, including roundworms, if you have them, if they're coming out. That's the nice thing about using complementary therapies like this oxidizing enema, because you actually can visually see what you're passing. And the crazy thing is you can get a stool test done, but they don't even look for worms in the stool test. My most recent student in the United States, she sent a fluke that she passed and she got the result back and the doctor's like, you don't have parasites. You should stop doing those enemas because you're probably just passing the lining of your intestines. So then my student looked at the results and it's 3 protozoa they look for. They don't look for a single worm. They didn't even look at what she sent in. I've heard this so many times that people send worms in their samples and then they say, you don't have a worm. They didn't even look at it. It's insane. Don't spend a lot of money on, like if you don't have to spend any money on a stool test, you can get it done. But just know that they pick up not even 10% of the parasites that we have. So if they're not even looking at worms and they're looking at maybe 5 to 10 different protozoa, maybe let's say 6 to 7 protozoa, 3 bacteria, they're missing like a couple of thousand of microbes that can make us sick. What's really distinct about the Live Disease-Free plan is that we really understand the importance of preparing to treat. So it's very, very important to follow the Live Disease-Free diet. It is really geared towards making the parasites less active, decreasing inflammation. Next week, I'm going to share a profound testimony of one of our students that she had multiple conditions. And just by changing her diet, she hasn't even started treating yet. Her life is completely different already. And she's been suffering for at least 13 years with all of this. When she started working with us, I was like, oh dear, she has so much going on with her. But I'm up for the challenge. I always want to help people. I can't make any promises. And I'm just she's blown away at how this has helped her so immensely. And she's just going to start treating now. And I'll share that with you next week also. So preparing the body by having daily bowel movements, sleeping at least 8 hours per night, and getting our carbs low enough that we feel so much better before you start treating. And we call that part of the prep phase in the Live Disease-Free plan. If you want to find the details for our diet, just type the word diet and comment the word diet and we'll send that to you so you can go through that and you can start making changes. You can start feeling better immediately. And then we support our physiology. There's a lot of steps into it. I have the masterclass training actually that you can watch for free. And that explains all the steps we take to recover, how to get ready to treat, how the treatment cycles work. All of that is listed on the masterclass training. The link will be just below this video. So in conclusion, these roundworms are a big problem. I have seen people passing them and they're instantly, tremendously feeling significantly better. And it does take work. They are linked significantly with multiple sclerosis, whether we're talking about the human roundworm, but especially the dog and cat roundworm. That's really linked with multiple sclerosis. And I've debunked the whole parasitic worms are good for MS. That is terrible advice. And then roundworms, we know that when they get into the central nervous system, especially their larvae, they cause a lot of damage. So, and then we've talked about all of the GI history of 5 years of GI symptoms before multiple sclerosis is even diagnosed. And then we talked about all the research. So I really hope you see that there's a really huge mountain of evidence I'm sharing here with you. And that if you do have MS or if you have another chronic disease and you've tried everything, like you're like, I don't understand. My diet is clean. I'm exercising. I'm taking all these supplements. I've been working with integrated practitioners for years, and I'm just getting worse. It's because you've never treated the parasites. They won't leave your body until you treat them. And they keep reproducing every year. They keep multiplying and becoming more prevalent in your body, increasing their population, increasing the infestation. And until you treat them, we do become more and more disabled in time. So if you can learn how to decrease their presence in you to the point where you feel really good and you have no more symptoms, and then you know how to manage that for the rest of your life, you can stay out of the care homes. Like for years and years, you can increase the amount of quality years. Like I'm getting to be 65 this year, and I do not want to be in care homes. So I am doing everything to manage the microbes, and I've learned that skills. You might think yogurt is good for you. You might think smoothies are good for you. And you're like, why can't I think? Why am I having such a terrible brain? Why am I feeling worse? It's because what you think is healthy, it's healthy, but if it's something that feeds the parasites, it's going to make you worse. And if you do want the research about the roundworms in multiple sclerosis, make sure to comment the word roundworms. If you want the diet, comment the word diet. And if you just want to know this plan, the Live Disease-Free plan, how you can recover, make sure to watch my masterclass training. And I do spend a lot of time researching this for you. If you go to our website, livediseasefree.com, you'll see a library. It's our blog. Just look at the topics that interest you. From this one, if you do roundworms, you're going to see actual pictures of what our students have passed. You will really begin to understand and believe and know that there is hope for you. There's an answer. There's a cure when you treat the root cause. So please help us to get the word out. That's all I ask, is to share this with others. So if you like it, if you share it, if you subscribe, all those things help to get this word out and get people talking about it and share this with practitioners. It doesn't have to just be a doctor. It could be any practitioner, integrated practitioners. We do have practitioners referring people to us because they're seeing our work, they believe in what we're doing, and it's really exciting. Our team will answer your questions. And if you want support, make sure to reach out, watch my masterclass training. Until next week with the next topic, I think it'll be about tapeworms in MS. Take care, bye-bye for now.